I would like to welcome you to my channel, That Middle-Aged Lady. My name is Denise, and in today's video, I wanted to share yet another one of my adventures after being diagnosed with bladder and uterine prolapse and being fit for a pessary ring. But before I get started, I first wanted to explain exactly what pelvic organ prolapse even is, what causes it, what the symptoms are, and what the current treatments are available today.
Pelvic organ prolapse happens when one or more pelvic organs, such as the uterus, bladder, and/or rectum, begin to descend or fall down from their normal position in the pelvic region. It can happen for a variety of reasons, including multiple vaginal childbirths, the natural process of aging, including loss of estrogen both during and after menopause, obesity, chronic coughing, repeated heavy lifting, and chronic constipation where you're bearing down. According to the National Institute of Health, approximately 50% of women between the ages of 50 and 79 will experience some form of pelvic organ prolapse in their lifetime. However, only 11 to 19% of women will undergo surgery for this condition. Symptoms of pelvic organ prolapse include pain and pressure in pelvic region, urinary symptoms such as urgency, frequency, and urinary incontinence, lower back pain, and pelvic organs protruding through vagina. Stages of organ prolapse. Stage 1, the organ has descended slightly but still remains within the vagina. Stage 2, the organ has descended further, reaching the level of the vaginal opening. Stage 3, the organ protrudes past the vaginal opening, but not to the full extent of the vaginal canal. Stage 4, this is known as complete prolapse, where the organ has completely descended out of the vagina. It is important to note that although the organ can slip completely out of the vagina in a stage 4 prolapse, it is still held in place by ligaments and rarely actually falls to the ground. Current non-surgical options include lifestyle changes, pelvic floor exercises, also known as Kegel exercises, and a pessary device, more commonly a ring pessary. Current surgical options include a sacrocolpopexy, which is a procedure where a Y-shaped mesh is attached to the uterus or upper part of the vagina if the uterus has been removed or is going to be removed during surgery. It is then secured to the tailbone in order to help lift and support the bladder and/or uterus. It is done through an incision in the abdomen, either laparoscopically or robotic assisted, and is helpful for women who have severe prolapse, either stage 3 or 4, for women who have had prior surgeries that were not successful to treat the condition, or for women who wish to keep their uterus and not have a hysterectomy. The success rate, according to the Cleveland Clinic, is around 90%. However, it is important to note that prolapse can reoccur. The next surgical option is a sacrospinous ligament suspension. This is a procedure that helps to restore the support of the vagina by using a patient's own tissue, referred to as a native tissue repair. It is done by creating an incision through the vagina in order to stitch the top of the vagina to the sacrospinous ligament, which runs along the bones of the pelvis. Then either permanent or dissolving stitches are used, where over time, scar tissue will form to further help support the vagina. This procedure is performed more commonly after a woman has had a hysterectomy or will have one during this procedure. According to multiple studies, the success rate is anywhere between 73 to 100%. However, it is important to note that reoccurrence can happen over time and will vary depending on each individual woman. With the next surgical option being a uterosacral ligament suspension. These ligaments are strong supportive structures that attach the cervix to the bottom of the spine, where surgery, also using native tissue, involves stitching these ligaments to the top of the vagina, therefore helping to restore normal support. The surgery can be done laparoscopically or vaginally, and is just one more option for you to discuss with your doctor. Success rates, according to Science Direct, are around 85%. However, just like with any other prolapse surgery, reoccurrence can happen over time, usually after the 10-year mark.
So how I learned that I have this is after I had gone in to see my gynecologist for a 6-week post-op checkup after I had both of my ovaries removed due to a postmenopausal cyst on my left ovary. And after he checked the incisions, did a quick vaginal exam, said everything looked great, went on to inform me, oh, and by the way, your uterus is falling out. Of course, I was absolutely freaked out because I had no idea or indication that it was even happening. And so I asked him if he had any idea what caused it and what exactly I could do about it. He said that it happens for a variety of different reasons and that it's actually quite common as a woman begins to age, and especially after she's gone through menopause, and that it's really nothing to worry about, that there are treatment options available out there. And then he said that he would like to start with me going home and doing Kegel exercises every day to see if that couldn't help to build up my pelvic floor to then try and help hold the uterus in place. So I went home and looked up how to do Kegel exercises just to make sure I was doing them correctly and started doing them twice a day. But then about maybe 2 weeks later, I got really sick with a bad cold, started coughing like crazy, and that is when at one point I went to go wipe after using the restroom and noticed a bulge coming out of my vagina. Thankfully, he did mention that this could happen during my last appointment with him and said that if it did, to just take and push it back up there again, that he has several women who actually have severe prolapse and are not a candidate for surgery, do not want to have surgery, or don't want to be bothered with a Pessary device, and so they just push it back up again every time it happens. He said it's not going to hurt you, and that way it will prevent it from slipping down any further. So I got up and washed my hands and reluctantly felt up in there. I'm not exactly sure what I was expecting, but I definitely wasn't expecting for it to feel soft and smushy, not to be too descriptive. But then I went ahead and pushed up, and sure enough, it just slid right up there. I did ask him during that previous visit how far I should push it, and he said just as far as you can. He said, obviously it's not like it's going to come up to your throat and out your mouth, and your hand is only going to fit up so far anyway. He said, so just do it as far as you can and then leave it at that. I then called the doctor's office to see how soon they could get me in, since I really didn't want to have to keep pushing my bladder back up in place, or worse yet, have it slip out of my vagina altogether. Thankfully, they were able to get me in about a week and a half later, where I then had to undress from the waist down and put that paper sheet over me. The doctor then had me lay back on the exam table, put my feet up in the stirrups, and then bear down. And the reason they do that when they suspect any type of pelvic organ prolapse is so that they can see exactly which pelvic organs are descending down and how far they're descending, just so that they can stage it. And this is when I was told that it was actually my bladder that was popping out of my vagina and not my uterus, and that I was in stage 3 prolapse. Just a side note, I do have 5 children that were all vaginal births, with my last child being born when I was 43. And as my friend always liked to say, he came out a damn man. He was so big, definitely larger than my other 4 babies were. So labor and delivery was definitely a chore. I ended up being in labor for over 2 days, where I was in the hospital for that whole time, where I remember thinking that they did things to me that no woman should ever have done to her in trying to get me to deliver this baby. I did ask them several different times if I could just have a C-section to get it done and over with, and they said no, that I've already had 4 vaginal deliveries, and so I can do this, and that they really don't want me to have a C-section unless I absolutely have to. And so eventually I was able to deliver a healthy, almost 11-pound baby boy. But I do believe with all my heart that that probably played a major role in why I have this prolapse today. That, and I also have always been a very independent woman who didn't like to ask for help, so I always thought I could do everything myself. And because of that, I probably carried more than what I should have carried. I probably lifted more than what I should have lifted. And I'm sure that that probably played a little bit of a role in this as well. And so if there are any younger women watching this video, my best advice to you is to remember how you treat your body today is how it's going to respond to you later. And so don't be like me and cut your nose off to spite your face just so you can say you can do it all yourself, because I can guarantee chances are in some way, some form, it's going to come back to bite you. And so I asked my doctor what next, seeing that I was in stage 3 and Kegel exercises probably weren't going to do much to help strengthen that pelvic floor. And he said that the next step would be to go ahead and fit me for a Pessary device. Normally, you would have to go to one of their other offices to be fit for a Pessary device, just because that's where they kept them at. But because he decided that he wanted to try a ring Pessary for me, and they're one of the most common Pessary devices to try, he asked the nurse to go and look and see if they had any there, which thankfully they did. Now, the particular one that he was going to use for me came in sizes 1 through 6, 1 being the smallest, 6 being the largest. And he decided, after doing the vaginal exam, knowing that I had 5 vaginal deliveries, and then knowing that I was in stage 3 prolapse, that he felt I would be a size 5, so just 1 size under the largest pessary, which surprised me because I'm not a large woman by any means, and I was a little bit worried about that. But I do have the actual first pessary that he first inserted in me, and this is what that looks like. As you can see, it is perfectly round. It is made of silicone. On this particular one, the inside of it has like a film that's almost like a latex material. It's super stretchy. It also has 4 holes, 2 large and 2 small. They also have one that doesn't have anything in the middle, so it's just open. The outside of it is also made of silicone, but it's definitely more hard. It's not thin like the material in the middle of it. And the reason for that is so that when they put it up inside of you, it's strong enough to then hold those organs in place. And then the reason for the holes, or having nothing there at all, is so that any type of fluid or discharge is able to make its way out of the vagina, since staying kind of stagnant up inside there can lead to an infection, and then it can also start to smell. And so if you take it where the 2 larger holes are top to bottom and you go to try and fold it, you're not going to be able to fold it. You can squish it down a little bit, but it's not going to fold. But if you take it to where the 2 smaller holes are top to bottom and you go to fold it, it will fold right down. And the reason for that is so that when the doctor goes to insert it, they can just put it right up there, because you don't want them inserting it when it's fully open, especially if you have a larger pessary like me. I can't imagine that's going to feel too good, if it would even fit. And so they'll fold it, they'll slip it on up there. As soon as they get it to where they want it to go, they'll release it. It'll pop open, and then the idea is for it to lock into place. After they fit you for it, they will then have you get up and walk around, sometimes jump up and down, sometimes even bear down, just to make sure that it's not going to fall out, because I can tell you that it is a trial and error process to get it right. Sometimes they might put one in that's a little bit too small and it falls out and you need a bigger size. Other times they might put one in that's too big and it doesn't fit comfortably, and so you need a smaller size. And then there's times where you might need a different pessary device altogether. Instead of the ring, you might need one that has like a knob on the end of it, or even one that's in the shape of a cube. So it just depends on your circumstances and what's going to work right for your body. You will also be asked to take it out, at least with the ring pessary, every 2 to 3 months to clean it and then reinsert it again. And this is because if you leave it up there for too long, it can change the pH level of the vagina and lead to an infection. It can also smell, and in some cases it can lead to a condition called erosion, which is where it begins to rub on the vaginal walls and thin them out. That leads to sores. Those sores can be very painful, and they can also bleed. There might be different regimens for different pessary devices. I'm not exactly sure, although I do know that I read with one of them, and I'm not sure exactly which one that was, but you're supposed to take it out every night, clean it, and then reinsert it, which to me just seems like an awful big commitment. But like I said, I do know with the ring pessary, it's every 2 to 3 months. And then from there, you have 2 choices. Either you can take it out yourself and clean it, or you can have your doctor. You have to go in to see your doctor every 2 to 3 months and have them do it for you. I can tell you that after I had my pessary put in, and then I got down, walked around, jumped up and down a little bit just to make sure it wasn't going to fall out, which at a size 5, I thought to myself it better not. And so after everything seemed okay, he asked me if before I left, I wanted to see if I could reach in there and feel it and pull it out myself to clean it, just so I would know whether I had to come back and have him do it or I could do it myself. And so I tried, but in all honesty, I couldn't even feel it, and I really didn't want to be fishing around up there and then end up causing an infection, or even if I could feel it, I would be worried about pulling it out, and because it is a size 5 and it is quite large, that I might do some damage. And so I made the final decision that I would just have to go back in and have the doctor do it, which he said is actually quite common and is what most women end up deciding, because most of them don't feel comfortable doing it themselves. During that first initial fitting, they'll usually have you come back in 2 weeks just to do a recheck to make sure that it's still fitting okay and that everything feels okay. So I went ahead and made that appointment, and then as I walked out of the doctor's office that afternoon, I felt so much better, mainly because I felt like everything was now in its proper place and I wouldn't have to worry about the bladder and or uterus falling out of my vagina anymore. So I guess if anything, it was just more a mental thing for me, knowing I didn't have to worry about it. So I was happy that I was able to get fitted that day and didn't have to make another appointment to go back again. However, about a week into it, I started to get quite a bit of pain and pressure in my pelvic region and also in my lower back. And so once I got back in for my 2-week checkup, I told him about that, and he said that we have to understand that anytime you put something in your body that doesn't belong there, It's known as a foreign object, and therefore our bodies just naturally want to reject it. And so he honestly felt like I just needed a little bit more time for my body to get used to it. And he felt like in time that it would, and that pain and pressure would eventually go away. And so went ahead and made an appointment to go back in and see him in 2 months, give me at least 2 months for my body to adjust to it, and then go ahead and reevaluate it at that time. Fortunately, that pelvic pressure and pain in my lower pelvic region, along with the lower back, did not get better with time. It actually got a lot worse, especially if I had a busy day where I was on my feet a lot or moving around quite a bit. And then I also noticed whenever I would sit, especially when I was in the car for whatever reason, maybe it was just the position I was sitting in, but I could actually feel that pessary ring rubbing up against my vaginal walls, which was not only very uncomfortable, but could be downright painful. And the only relief I would get would be to come home and lay in bed on my back without really moving around, which at least I did get some relief from it then. But then once I got up in the morning and started moving around again and started my day, that pain and pressure would once again come back. Once those 2 months were up, I got back into Sam. I explained the situation, and so I took the pessary ring out, looked inside the vagina, and said that everything looked good, that there wasn't any type of discharge, wasn't any infection, weren't any sores, and that he really couldn't see any reason for the discomfort. So I asked him if maybe he thought the pessary ring might be just a little bit too big and that maybe I just needed the next size down. And so he explained to me that he has been doing this for a long time now and that he has fitted many, many different women with pessary devices and that he's learned how to gauge it over the years, and that if I have a pessary ring that doesn't fit quite right, what's going to happen is it's not going to stay in place, and then it's not going to properly hold those pelvic organs into place like it should. He further explained that he's had quite a few women over the years that when they did have a properly fit pessary device, and they had it in for about a year or two, what can happen is you'll have scar tissue that will form around those ligaments. So kind of like the same thing as having stitches to hold them into place, but it's your scar tissue, so it's just your natural tissue. And that after the 2 years are up, they can take the pessary ring out. The pelvic organs are now held into place. They don't end up needing surgery. They no longer have to wear the pessary ring. And so that was his hope with me, that if we had the right fitting pessary device that was nice and snug, held those organs exactly where they needed to be, that eventually scar tissue would form, and after a year or two that maybe he could take the pessary out, and not only would I not have to have surgery, but I wouldn't even need to wear a pessary ring any longer. After he originally told me that my uterus was starting to fall out, I did come home and do a ton of research on it, and I did read that in some cases, if a woman wears a pessary device long enough, that eventually scar tissue can form, which will then hold the pelvic organs into place where she no longer needs the pessary device or surgery. So I knew there was truth in what he was saying. He's also been my doctor for a while now. He's done surgery on me, which went absolutely wonderfully. He's got me through quite a few other hurdles as well. And so I do think he's a good doctor. I do think he knows what he's talking about. And because of that, I went ahead and made the decision to go ahead and wear the pessary ring for a few more months, when I had to go back again to have it taken out to clean, and then to go ahead and reevaluate at that time to see how things were going. However, after about 3 more weeks, it finally got to the point where I could not take the pain anymore. I would come home from work and just cry my eyes out as I laid in bed because it was just so unbearable. And I finally got to the point where I thought, if he's got to take it out and I can't wear a pessary for whatever reason, and I'm not ready to have surgery yet, then I guess I'm just going to have to keep pushing the bladder back up again because I can't do this any longer. And so I called the doctor's office to get an appointment, but unfortunately he was on vacation, so they set me up with one of his partners for about a week and a half later. Once I got in to see her, I explained everything, where she agreed that perhaps it was time to try the next size down. Unfortunately, they did not have a size 4 at that office, so she said that she could just go ahead and take the size 5 out. I could make an appointment for 2 weeks later to get in to see my regular gynecologist, but at least I would have those 2 weeks to see whether or not it made a difference having that one out of me. Once she took it out, I instantly felt better. As I walked out of her office, that pain and pressure did not come back. The drive home was the best drive I had had in a while. No pain, no pressure, no discomfort in my lower back. And as those 2 weeks went on, I continued to feel absolutely nothing. So that is when I knew that the size 5 definitely was what was causing the problem. Once I was able to get back in to see my regular gynecologist, I then explained everything to him, how his partner had taken the size 5 out and how much better I felt. You could tell that he looked a little bit sheepish, almost like he felt bad for trying to insist that the problem wasn't the size 5, and he did apologize for that and said that he was just happy that the pain and discomfort went away. Thankfully, they had the size 4 at that office, so he went ahead and inserted it, had me once again walk around, jump up and down, since his biggest concern was that it was going to fall out. And that's the thing with a pessary device, is that when it fits properly, you're not supposed to feel it at all. You shouldn't even know that it's in there. So the fact that I could feel the size 5 and felt that pain and pressure, I knew that something was wrong, that something was not right. So once he inserted the 4, at least at that moment, I could feel absolutely nothing. Then he said, why don't we have you come back in 2 months, we'll reevaluate you, see how you're doing. So once I left, I continued to feel absolutely nothing. There is no pain, no pressure. I didn't even know the pessary ring was in there, which is exactly how it's supposed to be. Drove home, didn't feel anything, and as those 2 months went on, I continued to feel nothing. Got back in, took it out, did the vaginal exam, said everything looked great. He did suggest to maybe use a vinegar douche once a week or once every other week, just to try and help keep that pH balance of the vagina, which I do once every other week, and said, you know, it looks like this is the answer. It looks like we just needed to go the next size down. So I wasn't going to gloat too much. That's what I have been trying to say all along. But, you know, if anything, maybe it helped him to understand that even though he's been doing this for 35 years, doesn't always mean that he's right. And so if you are someone who is recently diagnosed with pelvic organ prolapse, my best advice to you is that when you go in and get fit for whatever pessary device you're going to be fit for, just make sure and use your voice, and if something doesn't feel right, tell them. And even if they insist that you try and wear it a little longer, if you're feeling it at all, then that should be an indication for you and your doctor that something quite isn't right. And so don't be afraid to speak up and tell them, I want to try the next size down. That is the whole point of doing this. It's a trial and error process, so that if the first one doesn't work, they try another one and another one and another one until they get it right. And again, you're not supposed to feel it or even know that it's there. Other than that, I hope that you found the video informative, as that is certainly why I do this, so I can share all of my experiences with other women out there who might be going through something similar, just so we can have that camaraderie. But if you have any questions or comments, please feel free to leave them, as I'm always happy to answer whatever I can. And I just want to thank you so much for joining me today, and I will definitely look forward to being back next time, as God only knows what tomorrow will bring.